The Austin Love Doctor, Episode 006, Sexual Hygiene, Circumcision, Paraphimosis, Cleaning, Yeast Infections, and the HPV Vaccine.
This is Dr. Charles Reynolds, inventor of the O-Shot, and thank you for joining Dr. Emily Porter, the Austin Love Doctor, as she openly discusses your most intimate questions regarding relationships, sex, and personal wellness through the eyes of a medical doctor who treats men and women for a variety of sexual issues using the latest medical advancements available. Get comfortable, relax, and welcome your host, Dr. Emily Porter.
Hi, it's Dr. Emily Porter, the Austin Love Doctor, and I got a question about circumcision. This is something that I think a lot of parents at least discuss. Most of us do in America have the discussion when we find out we're going to have a little boy. My husband and I certainly discussed it. And there's a lot of opinions, one way or the other. I'm not really going to have an opinion one way or the other. I don't think it's my job to tell you what to do. Personally, we did circumcise both of our boys, and that's because my husband and I, we're ER doctors, and we had seen not a lot, but every complication we ever saw that involved a penis, it involved an uncircumcised penis. So we had a little bit of selection bias with it. So, circumcision is one of those things that's very personal. At the end of the day, it doesn't matter what you do. You do you. If you think it's genital mutilation, you do you. If you think it's not good to do that to a baby, I can tell you, I've done them. I've seen them. The kids are sleeping. So if you've never watched one, here's what happens. So it depends. If you go to a bris and you have a moil on day of 8, they basically give them a little pacifier and they do it, and it's like 2 seconds and it's done. The kid barely even cries. In a hospital setting, some of the equipment that they use is a little bit more barbaric looking, but it's just kind of to hold them still. But usually what would happen is they do the same thing we do if we're going to do a spinal tap. And the kids don't cry for spinal taps either. They're very, very quick procedures. Little babies, they're easily pleased. Think about it. They just came out your vagina. They're used to trauma. They're pretty hardy. Or you had a C-section, they came out that way. That's probably the worst thing that happened to them. So this is sort of nothing. They usually take a pacifier and they make something called Sweet Ease. And it's basically, we call it baby crack. It's like sugar water, and it's very, very sugary, and the babies like it. And so we dip the pacifier on it, and they usually put some numbing cream on there. And then they do 2 little injections, and it's a dorsal block, which blocks the nerves that innervate the penis. And when I do the Paraphimosis shot, this is the same block that I do for that. I put some numbing cream on, and then I do that block. I don't probably need the block for it. A lot of people, including the Dr. Reynolds who invented it, he doesn't do the block. He just does cream. I always do it for peace of mind. And I tell people, did you have a boy? Did you get him circumcised? Okay, I'm going to do the same block for this procedure that we do for a circumcision. And if we can cut your son's foreskin off and he didn't cry because you watched him, then I can certainly use a couple Botox needles and inject some stuff in your penis. And they go, oh, okay. And now we have rapport because now they trust me, and it doesn't end up hurting them. So they put a little bit of lidocaine in there and block it. And then there's lots of different devices that they use with a scalpel. And sometimes there's a thing called a Gomco, and the mechanics of it aren't super important. But there's very few complications from circumcision done as a child. Most of the complications that happen with circumcision in an adult are because adults get erections. It's really, really hard to not get an erection if you're stimulated in some way. My grandfather had a circumcision in his 50s, and he said he would not recommend it. So sometimes it's a lot more painful because the tissue's healing and there's stitches and things like that. Whereas if you have a baby, it's basically just like the tissues just sort of get stuck together. So there's not even any stitches at all. And then babies don't get erections. So you just have to be careful around it when you change a diaper. It goes back, there's all these biblical stories about Genesis and the covenant between God and Abraham. And it's very cultural, whether, religious reasons or hygiene reasons. It seems to be kind of more of an American thing than it is a European thing. And we've kind of come full circle about what to do. Again, so the risks kind of are bleeding. I saw one kid, I think, in 12, 15 years in the ER, including my training, that had a little bit of bleeding or had a little bit of infection after he had a circumcision. There's certainly a couple other risks, but that's the main one. And we just put a little silver nitride on it and stopped the bleeding. And it was fine. There are some benefits to circumcision. People want to equate it to piercing ears. And true, they both are mostly cosmetic procedures. I'll give you that. I don't know of a single health benefit from piercing ears, though. Like, there's some cosmetic benefits, sure, but there are some health benefits to circumcision. And when you're babies, if you have a baby that has a fever and a baby boy, we're always looking for the source of a fever. So especially a fever in the first 6 weeks of life, and really, really, especially the first 28 days of life, you always have to get urine on every baby that has a fever, and you have to do a spinal tap, and you have to get blood and x-ray and all these things because they don't have any immune system. But after that, boys who are uncircumcised, when we're looking for an infection, we have to do a catheterized urine on them until they're a year old if they're uncircumcised. Whereas if they're circumcised, we stop doing a catheterized urine on them at 6 months of age because the foreskin does make them more likely to get a urinary tract infection. Of course, that only affects the first year of their life. But there's some sexually transmitted infections that are more common among and more easily transmitted among uncircumcised males. So, for example, HIV is more commonly transmitted and easily transmitted, actually 60% more likely to be transmitted from a male to female if the male is uncircumcised. We have a good handle on HIV now with condoms and things like that. But in a lot of countries, like in parts of Africa, it's rampant. It's a real problem. And so they kind of promote circumcision because they know that it decreases that risk for the women. And then also herpes and syphilis and trichomonas are more likely to be transmitted. What happens is that when you're uncircumcised, the skin can sometimes not stretch the way it's supposed to. That's called phimosis. So you're supposed to be able to, if you've never seen an uncircumcised penis, I'm trying to think how I could describe it to you. It's like if you had your arm in a long sleeve shirt and your hand normally sticks out the end of the shirt and you have the cuff, and then you pull your hand up and then now your hand is inside, but the cuff is still there. Do that right now. If you have on a long sleeve shirt that's got a long sleeve sweatshirt or stretchy shirt, because that's what it is. And then put your hand back out. That's how it's supposed to happen. So when a man gets an erection, usually the foreskin will pull back, and then you can't really tell that much with an erect penis, whether it's circumcised or uncircumcised. So there are women that they don't think they've ever been with one, but they have. They just haven't ever seen it when it wasn't erect. And so if that skin doesn't stretch easily, it can tear. It's a condition called phimosis. It's phimosis, phimosis. And the skin doesn't stretch very well. It can make it really hard and painful to get an erection because the penis it wants to come out and it can't get out. It's like you're having your elastic sleeve on your shirt be really, really tight, and now your hand can't come out. So that's one problem. And then there's something called paraphimosis, which is actually when the foreskin is retracted, but then something happens and it gets swollen or it gets torn or damaged. Usually it's with sex. It's like vigorous sex, and you get a little bit of swelling in the foreskin. And then now the erection goes away, but now the foreskin won't go back down over the glands or the head of the penis. So now you can't get it. Now, basically, if you have that shirt analogy where you've got your hand back out, but now you have a tourniquet on and it's cutting the circulation off of your wrist. So that's a problem because you can't get blood flow to the area. That's actually a surgical emergency. Paraphimosis is a surgical emergency. And so that can happen with sex. So a couple things is people need to make sure they clean their foreskin. I remember one time I saw this guy in the ER. I felt so bad for this dude. I was a med student and he came in and his complaint was that he was urinating from his penis, but he'd had a history of bladder cancer. So he had a urostomy, meaning that he had a surgery that diverted urine from his kidney to basically his stomach. He had a little bag that he wore on his abdomen, and urine went in there, and then he, dumped that out. So he hadn't actually urinated out of his penis in like 15 years or something. So now he came in and he's like, oh, I think there's something wrong with my urostomy because I'm urinating out my penis and I need to have it checked. So I was a third year med student, and my first thing always was, well, I should call the urologist because clearly this guy needs to see a urologist. But before I did that, I just made sure I did a thorough physical exam, which is really, really, really important, especially in emergency medicine. You have to roll people over and make sure they don't have gunshots on their backside that you're missing and things. So you always have to get people naked, especially when they're really, really sick, or they have trauma, or they're having a cardiac arrest and try to figure out what might be wrong with them. So I said, sir, I'm going to look at your penis now. You mind? And he said, no, I don't mind. And I looked, and he was uncircumcised, and I retracted the foreskin. And the poor guy had this raging yeast infection underneath his foreskin. And I was really professional, but kind of like, ooh, like it's so bad that it's dripping. And I asked him about his hygiene, and he's like, well, what do you mean? And I said, well, like when you shower, how do you clean your penis? And he's like, well, I said, you retract the foreskin every day? And he goes, no, man, I haven't had sex or peed out my penis in like a decade. And I'm like, well, I don't, use my elbow every day, so to speak, but I still wash it when I'm in the shower. I tried to be nice to him. So he saved the guy surgery because he just had a really unclean area. So you got to wash it, man. You got to wash it every day when you shower, and after sex, kind of clean it up. And the ladies will appreciate you if you do that, especially. I think there's a fear of uncircumcised penises, and they don't have to be nasty, but they can be nasty. So make sure you don't do that. And you got to keep the skin so that it's kind of loose so it doesn't crack, because that's where the risk comes from for transmission of herpes and STDs and HIV, is that if you have a crack or a fissure in the skin, then it can bleed. And then now you have blood going into a mucous membrane of the vagina. So that's where the thought of the increased risk is. There's also increased risk of penile cancer and some cervical cancer. Penile cancer is really, really, really rare in America, so I wouldn't know that I would hang my hat on that as a reason to get a circumcision, but it's pretty much non-existent for men who are circumcised. Cervical cancer, we now have Gardasil, the cervical HPV vaccine that we're giving to all young women and also young men, because that's where young women get HPV from, is from men. And then interestingly enough, and I didn't know this until fairly recently, there is a decreased risk of prostate cancer if you're circumcised, actually by 15%, if the circumcision was performed prior to you being sexually active. Prostate cancer is fairly common. For men, it's a really slow growing cancer. So most people get it detected and have it treated either with radiation or with prostatectomy, or there's these little pellets they can put in, or hormone therapy that they can use to prevent it before they die from it. But most people don't want to have a cancer if they don't have to. So 15%, that's significant. And then also we talked about the phimosis. So that doesn't exist if you don't have a foreskin. You can't have a phimosis or a paraphimosis. So the question that I had from a patient was, she wanted to know if there was she said she has a new partner who is uncircumcised, and she hadn't ever been with an uncircumcised partner before. And she said she noticed she's been getting a lot more yeast infections recently, and UTIs, and she wanted to know if that was maybe a cause. And the truth of it is no. I mean, they don't carry different bacteria there. If it's clean, everyone has bacteria on their arms and all over their body. So it's not really putting you at more risk for bacteria. In her case, she said yeast infections and bacterial vaginosis. What really is that they're using condoms, which is good. They're non-latex condoms because she has an allergy, but they're having a lot more sex, because she told me they're having this amazing female ejaculation sex. And so she's a 20-year-old woman who's just having sex all the time. You have a lot of sex with somebody, you're going to get UTIs, and if you're young and 20. And so it's more a cause of, or a result of them just having more sex, that she's more likely to have issues. So one of the things that she can do is go to always urinate after you have sex if you're a woman, because even though it's a different hole, when you urinate, the pressure that it takes your urine to come out, it kind of also like sort of cleanses out some of the vagina too. So it's just a good idea to kind of clean that. You don't have to shower, but go to the bed, go urinate after you have sex before you go to bed. That helps. And then she's taking a probiotic every day, and you can do yogurt. All those sorts of things are good. Stay away from any sort of lubrication that has glycerin in it. So Astroglide has glycerin in it, or any sort of those fun lubricants that you get at like a bachelorette party, or you get at a, gas station. It's like strawberry flavor, mint flavor, anything that sounds fun and sounds like it doesn't taste disgusting is not good for your vagina, because it means it has sugar in it. And you don't want extra sugar in there, because it's just a breeding ground for yeast and bacteria. So the strawberry stuff, the chocolate syrup, the whipped cream, all that stuff, keep it on the outside for the ladies. And then if you want to use it, ladies, on the men, that's all well and good, but then just use a wet washcloth and clean them off before you have any intercourse, and that's going in there, and protect yourselves. So your choice with the circumcision. I'm not going to tell you one way or the other. Whatever works for you and your family and your child, and just do what works. We did, because we just had seen a few things, and we didn't regret our choice, but it's certainly not necessarily the choice for everyone. So very personal, but now you have the facts and you can make that decision yourself. And I hope that you decide, and I hope whatever you choose, your son grows to be happy with it.
Thank you for joining Dr. Emily Porter, the Austin Love Doctor. If you have a question about your relationship or sexuality, please feel free to contact her directly at austinlovedoctor.com.